Riverview Health interventional pain differs from most other pain clinics because we take a very directed approach. We spend the time with patients talking to them about their ailments and allow them choices. What that allows us for is to focus only on the patient and less on the financial implications. I have more or less grown up from Southern Indiana, and so whenever I was training, I naturally wanted to go into a specialty to where I could help the people that I've grown up seeing, whether that be, friends, family, people in my community. Interventional pain is a sort of style of treating chronic pain to where it focuses less on medication management and more on injections. What injections allow is they allow for patients to, rather than being reliant upon a medication every day or multiple times a day, they have an injection, and that injection should last on the order of months to even years. So what interventional pain management really does is it allows patients to get back to their daily life as though they maybe weren't even experiencing pain to begin with. I would say that for my more basic injections, my success rate is usually 70 to 80%. So for those patients that don't usually succeed or have relief with those initial injections, then that's whenever those more advanced injections and treatments are coming into play as other options. I treat really from the head to the feet. I treat headaches, I treat back pain in and of itself. So I'm really treating any type of pain that is persistent. So whenever I'm seeing a patient for the first time, I really spend the majority of that visit educating the patient, learning their story and learning what brings them to me. And then from there, I go into detail about the treatment options, whether that's physical therapy, if they're wanting to be really conservative, to trying some basic medications, to then talking about injections. I'm typically seeing patients within 1 to 2 weeks from the referral time. So I feel like that helps quickly establish with the patient being evaluated to then being treated relatively quickly. Usually the ideal candidate to be seen by me is any patient that primary care doesn't feel comfortable treating, or any patient that isn't receiving the results that is expected from a treatment plan. I think one thing that's important is to understand that the physicians within the department all treat things differently. So we all offer unique treatment options. I think the most advice that I would give to a patient living in chronic pain that's tried a lot of things would be to not give up hope. A lot of the studies show that the mind is very closely connected with chronic pain. So I always encourage patients to have, a positive mindset going into treatment, because that's only going to further benefit them in the long run.